Welcome back. We are answering your questions about the coronavirus with the Moses H. Cone Memorial Hospital's Chief Medical Officer, Dr. Wyatt. Remember, you can text your questions to 336-379-5775. So one of the interesting questions we just got in is, how often do we need to wash those reusable masks that people are wearing?
Very good question. I think the quality of the ability to prevent the cloth mask goes down the more that you wash them. I don't think any studies have been done to directly correlate effectiveness with the number of times washing. I would say a maximum of maybe 5 times before you should probably go ahead and use a different mask or a newer mask.
I think I need to do some laundry this week then. A lot of people are also wondering about the mask. How much do they protect us? Like when we're out and about shopping, is that safe if you're wearing a mask?
I think more effective than just the mask is the distance between you and other people. The mask, the density of particles that could possibly get through a mask increases the closer you are to someone who may be aerosolizing and has the disease. So I think more so than just the mask is the distance, and also the fit of the mask. The more that it sort of tailors to the face and conforms to the face and keeps things from getting underneath by the chin or over by the nose would make it much more effective.
What about all that stuff you touch while you're out shopping? The shopping cart, the things on the shelves. Do we need to be worried about that anymore?
Yeah, you do actually. One area where we've seen some increased risk has been at gas stations where the pumps can be contaminated with someone who has COVID. So it's a very good idea to not only sterilize before and after you go to those places, but also make sure that, say in a grocery store, you ask the people who are responsible for sterilizing the carts if they have been done so, and then use another cloth or wipe that they usually have available there to wipe it off again.
At the beginning of all this, we saw people with gloves out. Is that a good idea?
Absolutely. If you have gloves available, I think you should use them. A lot of gas stations do provide some disposable hand covers that you can use when you're at the gas station. That's not generally used at the grocery stores that I've been to, but certainly if you have your own to provide yourself, that would be perfect. But it doesn't help though if you have gloves on that you're touching the cart and then you reach up and you touch your face during that process. You have to make sure you don't touch your face while you're out in public in general.
And don't touch your phone, which is then going to touch your face too.
It's a very contaminated area, yes.
Hey, while we're talking about what's safe and what's not, one viewer wants to know, is it safe to swim in public swimming pools right now?
I would not recommend that right now. I don't think any studies have been shown or any outbreaks have been shown that I know of, but I would not recommend that right now. Just being in those areas where the groups are generally a little bit larger than 10, I think would be risky.
Now, we want to have a reminder here of why we should all take this seriously. We are at record hospitalizations across the state today. How many patients are you guys treating in your system right now?
So I'm glad you asked that question. We currently have about 150 patients in our health system, most of which are hospitalized at the Green Valley campus that is separate from the majority of the patients. But we have COVID positive patients at all our campuses throughout the Cone Health System. As a matter of fact, our analytics department projected that we would reach a maximum census in our system of 150 by the end of December. We have already maximized that, and now they're predicting that by Christmas, we could actually have over 250 patients in our system that are COVID positive.
The Surgeon General said yesterday if this goes on, people might not be able to get a hospital bed for things like if they're suffering from a stroke or something like that. Is that a worry here in Greensboro?
It currently is not a worry, but it's something that we are planning for. And before we get to where emergencies are impacted, we would certainly have to decrease some of the volume that is more elective than before we would, jeopardize our ability to take care of emergency cases.
So right now, one of the key ways to stay healthy and slow the spread is to get tested so you don't spread it to other people. One viewer wanted to know, is that rapid test that you can do less reliable, or is it just the same thing basically?
So if they're talking about the antigen test, which is available and it's very rapid, comes back in about 15 minutes, the Department of Health and Human Services has already stated that it is not to be used for a screening test primarily. You can do that, but the reliability is not that great, generally somewhere between 87 to 90% of being positive. Sometimes there are a significant number of false negatives. So currently, in our system, we use the rapid test only on symptomatic patients. And if there's any real concern, we do follow up those tests with a definitive PCR test that has a sensitivity over 97%.
But any test is better than no test at all, correct?
Yeah, in the sense that you have to know more, you have to know the historical background of the person that's being tested. If they're symptomatic and they have a negative test, you may want to make sure that you're getting one that might be a little bit more reliable. Although it is the the antigen test, which is rapid, is more reliable in symptomatic patients, but not 100%.
So someone wants to know, if you are at home while you're being tested, should you quarantine yourself pending results of that test, or should you wait? How long does that need to happen for?
So, meaning, I guess, if they're living at home and they're awaiting a test, because they are symptomatic, I think you should quarantine yourself until you get the results back, yes.
Okay, we'll be back with more of your questions. Coming up, how important is eyewear to protect your eyes, and how long are people immune after getting the virus? We'll talk about that after the break.